Hello friends, welcome back to RJO Study Well. Today we will learn about lesson plan. Here we discuss about how to write lesson plan and what is the format of lesson plan. So today I represent one topic, lesson plan on oral and larynx cancer. See, this is the first page. Student profile. Under student profile you have to write name of the student, name of the supervisor, course, college name, class, venue, subject, topic, number of participants. That means how many students have present in your class. Next, time, date, mood of technique, mood of teaching, lecture come discussion, previous knowledge of student. Here you have to write student have little knowledge about this topic. Then every age, chat, whiteboard. Next is objective. First one is general objective and second one is specific objective. Under general objective, at the end of the class, student will be able to understand regarding oral larynx cancer, and second one is specific objective. At the end of the lecture, student will be able to introduce oral and larynx cancer, define oral and larynx cancer, explain the etiology of oral and larynx cancer, list out clinical manifestation of oral and larynx cancer, describe the diagnostic evaluation of oral and larynx cancer, discuss about management, discuss the summary of oral and larynx cancer, explain the conclusion of oral and larynx cancer, and then bibliography. Then specific objective. To introduce oral cancer content. Oral cancer is cancer that started in cells in the mouth or throat. Then teacher activity. Lecture come discussion. Teacher learner activity. Listening and asking questions. Every whiteboard evaluation. What do you understand by oral cancer? Second point is to define oral cancer. Content. Oral cancer is oropharyngeal cancer in which cancerous tissue located in any part of mouth and throat. Teacher activity, lecture come discussion. Learner activity, listening and asking questions. Heavy aids, whiteboard and leaflet. Evaluation. What is the definition of oral cancer? Then third point, specific objective. List out the etiology of oral cancer. Content. Excessive alcohol intake, poor oral hygiene, use of tobacco, malnutrition. Teacher activity, lecture come discussion. Learner activity, listening and asking questions. Every whiteboard evaluation. What are the etiology of oral cancer? Then fourth point, to list out the clinical manifestation. Content, dysphagia, pain in teeth, otalgia that is ear pain. Then teacher activity, lecture come discussion. Then learner activity, listening and asking questions. Abbreviate whiteboard evaluation. What are the signs and symptoms of oral cancer? Then fifth point, specific objective to discuss the diagnostic evaluation of oral cancer. Content, history collection, physical examination, CT scan, computerized tomography, MRI, magnetic resonance imaging. Then biopsy test. Teacher activity, lecture come discussion, learner activity, listening and asking questions, abbreviate whiteboard. Evaluation, do you know the diagnostic evaluation of oral cancer? Then point number 6, specific objective, management of oral cancer, content, blepharostomy, mandibulotomy, radiation therapy, chemotherapy, teacher activity, lecture come discussion, learner activity, listening and asking questions, abbreviate evaluation. Can you explain the management of oral cancer? Next is point number 7, specific objective. To discuss the nursing management of oral cancer. Content. Check the patient weight and level of activity. Provide proper oral care. Encourage the patient to maintain oral hygiene. Teacher activity. Lecture come discussion. Learner activity. Listening and asking questions. Abbreviate whiteboard. Evaluation. Can you tell me some nursing management about oral cancer. Then point number 8, specific objective. To define larynx cancer, content larynx cancer is a laryngeal cancerous that develops any part of larynx. Teacher activity, lecture from discussion, learner activity, listening and asking questions, aviate, whiteboard and clipboard. Evaluation, what is the definition of larynx cancer? Then point number 9, specific objective. Under specific objective, list out the etiology of larynx cancer, content, genetics, mutation, or dental hygiene, smoking, chewing betel nut, teaching activity, lecture from discussion, learner activity, listening and asking questions, ABA, whiteboard, evaluation. What are the etiology of larynx cancer? Next, point number 10, specific objective. To list out the clinical manifestation, content, sore throat, dysphagia, voice change, dyspnea, weight loss, teacher activity, lecture come discussion, learner activity, listening and asking questions, whiteboard, AVL, evaluation. What are the signs and symptoms of larynx cancer? Next is point number 11, specific objective. To discuss the diagnostic evaluation of larynx cancer, content, history collection, physical examination, chest X-ray, CT scan, MRI, and PET scan, positron emission tomography scan. Then teacher activity, lecture cum discussion, learner activity, listening and asking question, ABS, whiteboard, evaluation. Do you know the diagnostic evaluation of larynx cancer? Next point is specific objective, 12 point, management of larynx cancer, content, chemotherapy. Under chemotherapy, cisplatin, vincristine, these are the medicine names. And second one is radiation therapy. Then teacher activity, lecture cum discussion, learner activity, listening and asking questions, AV aid, chatbot, evaluation. Can you explain the management about larynx cancer? Next is summary. Through this topic, we give and gain knowledge regarding oral and larynx cancer and its treatment and prevention. Maybe everyone has understood this topic. The importance of correct diagnosis for further diagnostic and therapeutic procedures is pointed out. Next, conclusion. In conclusion, laryngeal cancer is very relevant in today's society because of lifestyle choice. Current thought for laryngeal cancer is organ sparing therapy for voice preservation. However, the older proven technique of total laryngectomy is still a primary modality for advanced laryngeal cancer. Additional pathology to consider. Next is bibliography. For bibliography, you have to write your own. Here, you have to write where you collect the data. You can write any book name. Okay, thank you.